So my name is Lina and I come from Sweden, where I did my bachelor in Lund University, called Development Studies. And I chose to come to Netherlands because I was excited to go abroad and try something new and to specialize a bit more. My bachelor was very broad. And I fell for SPPH because I was intrigued by the focus on getting ready for the labor market. And especially the practical internship was what really caught me.
I am Tim I'm 26 years old and I live in Utrecht, and I did also my bachelor interdisciplinary social science here. So I know some of the people here, the teachers, and I really like the thematic and interdisciplinary approach of the bachelors. So for me it was not really a choice to do the SPPH because I wanted to strengthen myself in social policy and public health, but also in the more practical way.
I liked many things about our program. I think, especially for me, I liked how we were taught to convert theory into practice in a very straightforward way. I know before theory for me has been this fussy thing that you never actually apply, but I was really intrigued by the concrete examples we were giving on how to apply it to contemporary issues.
And I think also the practical internship you do is also really good, because in my bachelor I learned a lot about many theories, many philosophers and sociologists, but it was concrete in a sense, but it's not concrete in the sense of the society, our society.
I think for me the most challenging thing was during this program being an international student. It's not a big deal, but it takes some time to get to know a new system. Even switching school, I can imagine, but now the grading system is different, the papers, everything was just very different. But I know I appreciated we had quite a close class, so there was always someone offering help.
I did a research internship at the University of Queensland in Brisbane, Australia. I learned a lot there, and of course a little bit about doing research. I co-authored some papers, for example, which was really nice. I did some statistical things, but we also had some experience in the field. So even with the research internships, you also get some practical knowledge.
I had only the practical experience, no research for me.
Right.
I was at the startup business accelerator company for health tech startups in Amsterdam, and it was really interesting. We were a small team, so we were all given a great responsibility to do different things. And I learned a lot both about the Dutch healthcare system and about startups, how they accelerate. But most valuable for me was all the contacts that I made, especially as an international. Now I feel a bit like I know more about the market that I want to go into and more about specific people that I could potentially contact.
I wrote my thesis in Australia, and what I did was I was thinking about Dutch and Australian students and the test anxiety. So our Dutch or Australian students experience more test anxiety than the other group, and Australian students are more prone to test anxiety, and I couldn't explain it with the predictors I had. So that's really nice for further study.
I wrote my thesis about mobile technology, and especially about mobile health tools that can promote active and healthy aging among elderly. I found this a really interesting and very relevant topic. So I did a scoping review, which is similar to a literature study, where I used existing articles. I really enjoyed the process because it was very independent. I wasn't dependent on someone else's input or someone else's interviews or anything, but I could do it in my own pace, and I'm very happy with the result and how I could pick exactly the topic that I really like.
My future plans after graduating SPPH is that I will be a trainee at a consulting bureau for the social sector in the public sector. So I will be working with government agencies like municipalities and provinces. I will help them and advise them on some topics, social topics that we also learned in the masters. For example, reintegrating for people that were sick, for example. And I will write some advisory papers about it, or I will join them for a few days a week and help them with that subject.
So now after graduating, I will definitely stay in the Netherlands. I'm eager to get my first job here and explore the labor market. I think that the context I got from my internship opened up a network, so I know a bit where to begin, which I felt I had no idea about a year ago. And I think that what SPSPH taught me opens many doors for different things. So I will try to look into social policy, but also mobile health and maybe development and health there. So I'm eager to explore.